It's
do you think?
directly applicable, of course, to the centerpiece of the legislation, which is to force people who are not now insured to be insured. Well, that's going to lead to an offsetting kind of behavior, which everybody in the insurance business understands. What I've been talking about is called the Peltzman effect. In the insurance industry, is called moral hazard. It's exactly the same effect. If you insure your house against fire loss, there'll be more fires because you won't have as great an incentive to take care. And everybody in the insurance industry understands that. Well, it holds with health care too. So that will be the most obvious where people will have people who now are forced to buy insurance when they otherwise wouldn't will take less care, and the total costs of health care will go up. Beyond that, you have the peculiar characteristic of most health insurance it's not experience rated. In fact, the law says you can't experience rate. So one of the deterrents to taking less care when you insure your house against fire is that if you do have a fire, your insurance premiums will go up in the future. Well, by law that can't happen because pre-existing conditions, so to speak, can't be a grounds for raising your insurance rate. So there's going to be obviously less care taken to avoid pre-existing conditions. They're not given by the Lord. Sometimes they're unavoidable, but sometimes they're affected by behavior, and you'll have more of that. So both of those will raise the cost of not just of insurance, ultimately of insurance, but of health care generally.